Hello, my name is Irene. I'm a pharmacist working with Health House International. Health House is a medicinal cannabis wholesaler that is pharmacist run and stocks a wide variety of different medicinal cannabis brands and products. In this short video, I'll be covering the changes to the Special Access Scheme and Authorised Prescriber applications for prescribing medicinal cannabis. Now, the first change which has occurred is as of the 22nd of November 2021, SAS and AP applications to prescribe medicinal cannabis will now be made by active ingredient under a category based on cannabinoid content rather than by trade name. So in the past, an application would be submitted under a trade or a brand name. However, moving forward, the prescriber will now need to select a category to complete their application. This approach allows for flexibility when prescribing and when in the need of a brand substitution. So, for example, in the event of a product shortage or discontinuation. These 5 categories are the following. So category 1 are your CBD products, where the concentration of CBD is greater than or equal to 98%. Category 2 are CBD dominant products, where the concentration of CBD is between 60 and 98%. Category 3 are balanced products, where the concentration of CBD is between 60 and 40%. Category 4 is where THC is in the concentration between 60 and 98%. And category 5 are your THC products, where the concentration of THC is greater than 98%. You can find more details about the categories and their requirements on the TGA website. So how does this affect pharmacists? What this allows for is substitution between products is now permissible within the same category when needed. So now a prescriber does not need to seek approval from the TGA for these changes in brand within the same category. As always, pharmacists should dispense prescriptions according to their relevant state or territory. And a pharmacist's decisions for substituting medicinal cannabis should be made in accordance with normal dispensing practice. And any questions regarding the prescription should be directed towards the prescriber. And what does this mean for the prescribers? It means that the administration burden for applying for every brand is now removed. The second change which has occurred is that now there are certain medicinal cannabis medicines which have been included in the Authorised Prescriber established history of use pathway by reference to active ingredient categories, dosage forms and indications. Approval from a HREC or a Human Research Ethics Committee is not required before applying to the TGA to become an AP of these products. Now, a snapshot of this list, which you can find online, you can see here that it covers in the list of authorised medicines with established use of history, covers products in categories 1, 2 and 3, but only for refractory chronic pain and anxiety in the dosage form of oils and capsules. And how does this affect prescribers? Well, it means that once a prescriber makes a decision to prescribe a medicinal cannabis product on this list, titled the Established History of Use list, the prescriber then logs onto their TGA portal and applies to the TGA to become an authorised prescriber. Once the prescriber is approved, prescriptions can now be written for patients without having to go back to the TGA each time for every single patient. All that is now needed moving forward is a 6-monthly report given to the TGA based on the number of patients that this doctor sees. And finally, the standard protocol applies for when dispensing medicinal cannabis. A prescription and a copy of the TGA approval letter are given to the pharmacist, where the pharmacist will provide the patient with the medication within a few working days. That's the end of the video. Thank you for watching. If you have any questions regarding these changes, please feel free to reach out to a Health House representative. Thank you.